And let me know if this doesn't come in great. But I appreciate you having me here today. Like he said, I'm a pediatric psychologist at Nationwide Children's Hospital. I spend about half of my job providing outpatient therapy to kids of all ages who have any behavioral or emotional concerns that come up and also have a congruent medical condition. The other half of my job is providing support to families who are hospitalized for long periods of time, specifically in the intensive care units, where parenting stress can feel so difficult. My goal for today's talk was really to provide a good overview of parenting stress, but I would like to give it really practical solutions. So while stress is expected for any given person, I think it's even more so when you're a parent, even more so in a parent in a pandemic, and even more so when you have a parent who has a child with special needs. And so I want to go over the different types of stress and then really talk about what are the ways we can manage stress, both proactively, how can we plan ahead and try to reduce the burden that we carry, and also how do we react when big things come up and we feel struggling. I also attached some resources at the end that I think are really helpful. So to begin, I love being a parent. I think being a parent has been the most rewarding part of my life. The closeness I have when my son wants to snuggle, when he wants a hug, or when I provide comfort before bed. I love seeing him accomplish new things and learning together and playing and laughing and dancing and singing. It's been great. At the same time, there's also more laundry and planning meals and sleep routines and meltdowns. And I think I have a plan, but the plan is derailed because the kid didn't agree with that plan. Or trying to get my kid to zip up their coat on their own when they're not in the mood or they really can't do it. Or allowing them to have interests that I don't feel as passionate about, but this is what they want to grow. Or managing disagreements between myself and children or siblings, and even just getting them ready some days. Parenting comes with a lot more tasks than we ever had before. And then when you're parenting a child who might have more special needs, it gets even more complicated. If your child is having trouble making movement milestones or doing things independently or understanding what we say, if they're having a hard time paying attention and following through, or managing having a tantrum, or being a really picky eater, or struggling with toileting, that makes the days even more complex. So stress, I would say, would be expected. We're also in a different bit of a time. We're having a COVID-19 pandemic, and this is something none of us have ever experienced before. One of the hardest parts about it is that the virus isn't visible. It's not something we can tangibly see that we need to fix. We just know it's out there and we have to adapt anyways. For us, that can mean a lot of changes to our daily routines, our work schedules, our insurance supports and our job supports, how we interact with our support group, how our kids interact with their support group. What does schooling look like? How do I manage my schedule? Everything has changed and different. So if we already had the stress that I would have said existed before the pandemic, it's now more complicated. So let's talk about stress. What is it? I think a lot of people, when they say, oh, you're stressed, it seems to have the connotation of you're not managing things well. And I don't think that's a fair explanation of stress. And I want to break it down to how I see the different components of it. The first part is there's physical stressors. So thinking about not having enough food or water or sleep. I am very well known for being hangry. At 5 o'clock, no one talks to me until I've had 2 slices of cheese and a couple crackers, and then I can regroup because my body is stressed. If you have pain or wake up with a headache or you wake up with a stuffy nose and allergies, your body is stressed. If you have an injury or surgery, you start a new medication that starts to influence your body is stressed. And that's just one component of it. Then we add in emotional stressors, days where I feel more angry or frustrated or more worried or more sad, or even days where my emotions change more rapidly. That makes me feel more stressed. I want to be really purposeful here that I didn't write depression or anxiety because it doesn't have to be a whole mental health disorder to breed stress. It's really that ebb and flow of emotion that we feel over time that it can impact how we feel. Then we have more just life stressors. When my friends are going through something and I feel so badly for them, I feel stressed. When school's shut down or my work isn't being flexible, I feel stressed. When my kid isn't hitting their milestones or they're having a meltdown in the middle of Walmart, I feel stressed. When my finances aren't going well or I have more appointments or I found mold in the garage, that again adds to the stress. And then all of these things can lead to cognitive or kind of just brain stress when I'm having more difficulty remembering things or paying attention or understanding what you're saying to me, or my brain gets really negative. That again increases my stress. But none of this exists in a vacuum. Most of you are hearing all this and you're probably checking a couple of these things off. What I find is very few people just have one stressor at one time, but instead it becomes accumulative. And I'll show you a graph in a minute. But if you follow along with me, let's take a day where you're so busy with 3 kids and you're running around getting everything done. You realize, I haven't ate or drank anything in hours. I'm feeling really off. I'll do it in a minute. I'm going to run and get the mail and put away a couple of things in the yard. And then you get a bill, and the bill is large. So you start making a phone call to try to solve the bill, and you're feeling really worried and stressed about how you're going to afford the bill. But now that's longer that you haven't ate or slept. And now you're actually having trouble processing and following what they're explaining to you on the phone. And that's because your body is stressed, and all of these things are compounding upon each other. So in a perfect world, if you follow that blue line, the incidental stress, if something really rough happens and then it gets better, maybe something rough happens and it gets better, but I feel that's very rarely how life looks. Instead, it's cumulative. It's this red line of I didn't get enough food and water, and the bills are piling up, and my kids aren't getting along anymore, and now I have to teach them at home, and stress is building and building. So this isn't that you just didn't handle one thing, but that there are 1,000 grains of sand building up, and stress is now just existing. And then there's parenting stress, the stress experience related to parenting, the things that are on my mind as I'm trying to be a good parent. I would like to edit this slide. I wish I could. It was an infographic I stole, but of parenthood, and in COVID and not in COVID, but there are so many layers of things we're asking parents to do. Stay up on all the information that's changing day by day, and keep everything really clean and put away, and keep them away from other kids because that's easy, and take a break and take care of yourself and work from home and teach your kids and don't pay too much attention to the news. And again, take care of yourself while you're disinfecting everything, and all the rules change. You can see how this cumulative stress is getting bigger and bigger and bigger. In addition, when you have a child who has special needs, you might have a plan for that day and you figure you're going to tackle the stress that's on your plate, and then something derails that, something throws you off, and where you thought you had that plan, that wasn't the plan your child had that day, and that can increase your stress. And what happens when we have more stress is we find we're not the parent we set out to be. We're less likely to really listen when our kids are talking because 20% of our brain is trying to figure out what we're going to make for dinner. We're more likely to yell because we're trying so hard to get this recipe ready for dinner that they're interrupting us and we feel resentful. When we're reading a book with our child, we're having a hard time paying attention because, again, a part of our brain is trying to solve another problem. And the things that we're trained to do, we know that if we explain things to our kids and we have their attention and we keep what we say to them really simple, that they do the best. We don't have the energy to stop ourselves and be proactive about that. So we just shout off directions and then they don't do what we want, and then we feel more frustrated. And all of these things add up to feeling more guilt. And I struggle with parent guilt. It hurts. And the more guilty I feel, the more stressed I am, and the more likely this is about to happen. And you're going to find what I talk a lot about is that these cycles keep happening, and that's what maintains stress. If we're taking a step back, though, stress can come in 2 forms, and we don't often talk about eustress, which is a fancy word for saying positive stress. I really look forward to sometimes having a kid's birthday party when we're outside of a pandemic, or their school recitals, or their plays, or their debate competitions. Whatever it is your kid has enjoyed, those are things that might get you a little bit amped up. You're a little nervous for them, but you're excited to see it. You're planning things around it. That's good stress. What we mostly usually focus on is distress, though, the stress that brings our bodies down and makes us frustrated and struggle. But there's a reason we have stress. And I often go back to, if you think about middle school or high school, you can probably think of some peers you had that didn't really care about school. They weren't stressed. They also probably didn't get that much done. When you don't have a lot of stress, you're less motivated to set a list of priorities and start to accomplish those things. So by having some stress, by climbing up that green ladder and going into the yellow to the very top, more stress helps us get more done. That makes us feel better about ourselves. That keeps that cycle going. But where we struggle is where we fall off the orange and much closer to the red. When the stress starts to accumulate and accumulate, now it's getting in the way of getting things done because I'm having a hard time paying attention or concentrating and reminding myself to eat and dealing with all the surmounting stress. That's when it gets too much. So as parents, I don't want to take away your stress. That wouldn't be very helpful. What we're trying to do is dial it back so it's in this more manageable zone. And so I've mentioned a couple of times, your body feels stressed. Your body feels stressed. This is a very large infographic of all the things you might notice in your body and not notice in your body. To break it down in simplest form, the example we most often use is if a tiger jumps through the window. It engages our fight or flight response, and I hope you want to run from the tiger. I don't believe we're ready to fight it yet. But what happens at that moment when the tiger jumps in? My heart starts to beat faster. I feel very nervous. And then my lungs start to breathe faster, and I'm panting, and my heart is beating faster. My lungs breathe faster. My muscles start to tense up because I am bracing for something bad to happen. And as I brace for something bad to happen, my veins and my arteries that bring the blood all the way down to my fingertips and my toes, they shrink up. And then what that does is it changes, because as my heart is pumping faster and pushing blood through, but the hole is smaller, it takes my big smart brain that sees everything and it starts to get really narrow. Get away from the tiger, get away from the tiger, get away from the tiger. And that's how our bodies are supposed to work. Our blood wants to stay right here to save the organs we need. I really need my heart and my stomach. I could probably live without my arm. Where it gets more complicated is now you and I are facing parental stress in that similar way. It's not a tiger jumping through a window. It's a bill and a meltdown, and that I don't know what to cook for dinner tonight, but my body is still reacting that way. I might not be panting, but if I was hooked up to hospital equipment, I would notice my heart rate is up, that I'm breathing a little faster, that I'm starting to hold my muscles tight, and that I'm having a really hard time thinking through everything, and I'm getting really narrow and focused and frustrated. The more you pay attention to your own stress, you'll start to notice what your tell signs are. To give you an example, I am a jaw clencher, and I noticed during the pandemic, once I returned to work, I would feel very tired right here. It meant I wasn't even realizing probably all the thoughts that were running through my brain. And so once you learn your tell signs, we can also start to dial that back, and we'll talk about that today in some of the different examples that we give. So we're thinking about stress. We're going to first start with what are the proactive ways, the ways we can think ahead and plan our life to reduce some of the stress burden. And then we'll switch to, okay, let's say I've done everything, but a problem comes up. What should be my plan of action to handle it? I would be remiss to not go over depression and anxiety, though. So when stress builds and builds and builds and borders a point where we're getting more closer to mental health concerns, I want you to be able to recognize that. Depression and anxiety are normal. They happen in about half the population at some point, and it does go away, and help is usually warranted. So depression isn't always someone sitting in their bed and crying all the time, but it is feeling more sad or down for about 2-week period most of the time. This might look different than traditional sadness, though. It might be extreme irritability, crankiness, frustrationness. We also find that some people just report feeling muted and very disconnected, that they walk around, in the words the kids use, blah. They also start to get more hopeless or feel guilty or start to feel worthless, like, what's the point? I don't make an impact. And then as you're doing things that you usually like, such as playing with your child or taking a walk, you find you're not even really enjoying it as much as usual, so you probably do it less. Some people eat more, some people eat less, some people sleep more, some people sleep less. Some people get really fidgety and they increase their motor movement, and some people start to move more slow. Lots of people report more fatigue or loss of energy and having a difficulty with concentrating and hyper-focus on situations where you're getting really narrow and it's hard to not be stuck. And at its worst, when it feels really hard, some people start to think about harming themselves. And this would be when we would want to talk to a mental health professional, and we'll discuss that later as well. Anxiety has some similar symptoms, but comes from a different spot. It's coming from excessive worry. Now, I've just told you that stress is normal, and I mean that worry is normal. But what we're really worried about is when worry is hard to control. So that's when I'm talking to my good friend and I called them on the phone, and instead of enjoying it, I'm still running the worries in the back of my head. Or I'm in the grocery store and I realized that as I stared at the meat, I pulled out pork chops and I meant to get salmon, but because I was thinking so much about what my kid's school plan looks like next year, that I had a hard time registering what I was trying to do. Some people also notice a lot of physical manifestations, so feeling more restless or fatigued or having a lot of irritability and muscle tension. And at its worst, it can then turn into more anxiety attacks or panic attacks, which are more short versions of really intense physical feelings related to worry. So all that across, I want to talk about how do we manage stress proactively? How do we look ahead at our life and think, how do I make some differences? What I try to do in this section of the talk is give really practical ideas and with the hope of, as you're listening, trying to pick 1 or 2 things that you could maybe do differently in the coming weeks. We've all heard the old adage, you can't pour from an empty cup, so we need to take care of ourselves. Meaning that if we're depleted, we can't give our kids and our work and our husbands the water. It's really annoying, but it's true. We really need to work on our cups, and you are worth addressing. I talk to people about kind of filling these buckets, being physically active, making sure you accomplish things, being relaxing and restorative, and being social. That said, it's very few people who probably check off each of these boxes every single day. But if I looked at your past 2 weeks and took snapshots of every 3 days, would I say that you got close? And if not, it might be worth taking a thought about what could I build up a little bit more to help myself manage the stress that I can't change. If we're starting in a physical activity, and I was thinking about things adults can do still during a pandemic, there's lots of typical workouts of things you do at gyms, but also getting outside, going on walks or hikes. Lots of people like 5Ks or marathons. Those are discontinued at this time, but a lot are doing virtual, where if you sign up and you still have this purpose, you're more likely to do it, and you're more likely to feel good about it because it still felt like an event. There's socially distant yoga. There's some great high intensity interval training workouts on Pinterest. There's some interesting throwback workouts that some of my friends and I have been doing, things like abs of steel, buns of steel, MTV dances, step aerobics. And I'll talk about some competitions later of ways to engage other people. I'll tell you right now, we're doing a step challenge at work where our insurance company makes us wear a Fitbit to get a minimum amount of steps in order to get a reduced rate. I hate it. I hate wearing a Fitbit around. It doesn't look good with my clothes. But I secretly also like it because it's fun to log in and see how many steps I got and see how my friends are doing. And it's a way I start to feel connected with people, even though I'm not walking with them. It also pushes me to move a little bit more when I see how much I'm walking. And maybe you're more likely to do an extra flight of stairs or walk a lap of your house as you brush your teeth. I've seen some people do distant boot camps where they join in a parking lot with 3 or 4 people and write exercises out in chalk and still stay 6 feet apart. Or just have a dance party with your kid, but doing things that move your body, that release the good feeling hormones that are already in there that only come out with activity. When I was thinking about parenting stress, though, I realized that it's hard for us to really work on reducing your stress if we notice our kids are stressed. And so I wanted to give examples of ways you can get your kids more physically active. So think of things like walking at different parks. My neighborhood actually does a rock exchange where kids paint rocks of all different types and they hide them in the parks. And then kids can go to the parks and find these painted rocks and take them home and bring new ones back. There's even a Facebook group where kids get to post what they're planting or what they find, and it keeps kids really engaged. Pinterest has a lot of scavenger hunts where you can find things to look for on the walks that keeps kids really motivated to keep going and keep moving. I'm not an expert in geocaching, but it is a goal of mine to find out. But from what I understand, you pull up maps, and as you follow them in these different areas, there's sometimes destinations where you can take a prize and leave a prize for the next person. And again, it's a way to be active and still feel like you're connected to others in a distant way. Bike rides and hikes are really great, but even making it a little more motivating, making a checklist of all the metro parks in your area, and we want to hit all of these fall. Then the kids feel motivated to cross things off their list. There's silly workout videos. I've heard Go Noodle is a good program. Playing video games, which we know kids love screen time, but things that are more active and get them engaged. There's pedal boats and kayaking and horseback rides, or even making different obstacle courses inside or even outdoors in the backyard. Things that you can be done as a family that keep people moving. That second bucket we talked about was accomplishing things. And when I made the list, I realized my kid slide was similar to the adult slide, but it can be a little bit different. You see, you're probably accomplishing a lot of things. We are taking care of our bills and cleaning out the kitchen after the end of the day and organizing the next day, but it doesn't feel really great. A bottle of champagne doesn't explode and streamers don't come down when I get all of those things done. But there's something about coloring a picture that at this moment, I'm coloring this section pink and this section orange and this section blue. And at the end, I have something that looks really nice. And it feels good to see I did this and I accomplished this. And so while you do accomplish a lot of things from an organizational standpoint, thinking of things that are different that really engage you and bring you happiness. A lot of people are knitting and crocheting lately. At the beginning of the pandemic, a lot of people sent each other canvases and they would paint them and then have parties where they got together and showed people what they painted, even if they're not really painters. Building model cars, making jewelry, cooking something different. I noticed a lot of not creative people started buying these paint by numbers or jewel by numbers or sticker by numbers, and especially the bigger ones you can get for sometimes $9 or $10 on Amazon, but they give you a chunk of something to do each day. And again, that spreads over time, and so you see things get better and more pretty, and it fills your space. Things like planning a family fun day, organizing something in the home, building a piece of furniture, or lawn work. Now, these are things that not always the kids are going to be as excited to do. I've talked with a couple of families about mowing the lawn or weeding. Kids don't love it. However, when we push them to do it and get through it, they usually feel pretty proud to show people that they did it. And that's something we're also working on, is that if I push you through the hard thing, you get to feel the pride. You get to feel the good that you did something. And that's where that comes through. When we're thinking about where do I want to go about, how do I want to pick something accomplishing? I already cook a lot. I want you to think about being different and purposeful. So when you think about exercising, people who run a lot, and if they run 3 times a week, their body gets really used to running. And so they start to actually not burn as many calories and build as much muscle because their body expects to run, so it gets really good at it. But there's people who cross-train, who they run one day and do yoga the next day and do high interval training the next day. And then their body has to second guess, what are they going to do? What are they going to do now? And it burns more energy. The same thing is for our mental health. If I cook the same meal every day, I become uninterested. If I'm finding new recipes and really engaged with following it along and enjoying the smells, I'm going to get more out of it. The other thing is being really purposeful about what we are doing. If I ask most people, especially of younger children, what would you do with 15 extra minutes? They say, I would go to sleep. Because sleep doesn't make you feel any better. And if you purposely say, I'm using these 15 minutes to take a walk and drink coffee outside by myself, that's more likely to improve your mental health because you set out to do something for you and that matters to your brain. The next bucket is rest and relaxation. At the end of this program, I put a list of apps that cover different types of meditations. These are things like diaphragmatic breathing, learning to breathe in really slowly through your nose, out through your mouth, learning how to reduce your muscle tension, learning how to take your brain somewhere else. And again, when we talked about our body being amped up, these are the strategies we can do to bring it back down. They take practice. So doing them for 2 to 4 minutes when you're not stressed out for a week or 2 is going to make it much more effective when you are feeling more stressed to having it work more quickly. For some people, this is not their style, and that's okay. Other types of things you could do are baths, or some people like yoga or stretching. Some people really, when they read a book, feel very zen and into the story, and that's a great idea. Some people go for walks or listen to music, and that might be playing the piano or the guitar or singing in your car by yourself or just listening as you sit back. But finding a way to take just 5 minutes away for yourself can go a long way. It doesn't always have to be a 30-minute bath. Small doses more frequently have shown to be just as powerful. And then we think about socialization. So for kids, trying to get them physically active, so maybe doing distant walks or bikes or meals on separate blankets or outdoor movies. Some things that kids did in my neighborhood recently is they did a hopscotch tournament, and I encourage you to go on Pinterest and look at this. Kids are making really fun, different styles of hopscotch where they have turnaround sections and jump 10 times and touch the ground or do a leap. And by doing these fun ones, they were all over our neighborhood. It made it fun for kids to just go on walks and then engage in this different thing. Another weekend, they did a chalk competition where they marked off sidewalk so everybody could color a different picture. This again gave kids some accomplishment. It kept them busy for a few hours. And then we had something beautiful to look at as people went on walks. I think a lot of parents have told me that they've tried to also set up their children to do more video conversations with kids their age, and that those haven't gone as well. The kids aren't really sure how to engage and what the social skills parameters are in these things. What I have found is kids do much better if we give them what to do on these phone calls. So if we can teach them to have an activity, a scavenger hunt. Okay, everybody run and go get something fluffy and bring it back. Everyone run and get something cold or red and bring it back. And then you're having this fun game of show and tell. You can play a game of categories. So I'm going to name a brand of candy, and then you name a brand of candy, and we go back and forth until we feel stumped. There's online video games like Uno or Monopoly, or playing Would You Rather, or preparing a joke to tell. But when kids have an activity, I find that they're getting much more out of these social interactions. It also is similar to the relaxation part, where 15-minute phone calls go just as far. It doesn't have to be a big 1-hour conversation. What we're looking for is small doses of feeling good time where I interact with another person and feel like I'm getting some of that connection. What do we do as adults? So some of those things still pertain. I found a lot of people are doing distant park hangs or walk, or using more social media for support. But I'm encouraging more people to make more phone calls. Texts are great, and it's hard to find time for a phone call, but again, a 5-minute phone call can really help feel heard. A 10-minute video platform after the children go to bed with a good friend, it makes a difference. I've seen a lot of people doing book clubs, and even more recently a podcast club, which is, I think, more engaging to more people. I just learned from a family the other day about people doing drop-offs. So one person would buy a vat of cinnamon rolls, and then they would drop off with their 3 closest friends cinnamon rolls for everybody to eat at the same day. And where you're not maybe being together, so you could Zoom at the same time, you feel connected that we're all doing the same thing, and picking a different topic every weekend can be fun. Getting together for bonfires, or even scheduling pool times where we can shout together from different areas. When adults get together, I think it's really important to have time to vent or to gloat about where your kids are doing, to talk about the great things that they've accomplished and the ways you're proud of them, and also things that have been frustrating or hard, or that you're worried about them. But what I've noticed sometimes is parents have gotten a little bit stuck with their limited social interactions, and they get a little stuck in just talking about their kids, and then they leave still a little bit unfulfilled. It's important to still talk about movies, or what's going on in your extended family, or music, or politics, or whatever makes you feel intrigued and interested, or just to hear about other stories, and talking about our kids and balancing that with talking about ourselves. The other conversation I've had in recent weeks, especially as I know a lot of parents are making choices about what to do next with school, is again getting stuck in those conversations about the pandemic and what's happening. And then again, we don't get as restored or feeling as fulfilled socially from those conversations. So it's finding a balance. So that's well and good. And that's a lot of practical tips, but that also doesn't mean it's easy. I think about, there's weeks when you might have a good meal plan and you've planned out what you're going to eat each night, and you go grocery shopping on Sunday and you chop a lot of vegetables so they're ready. And as you come home, you can throw things on, get dinner ready, and then you can have fun to play with your kids or get other work done. And then there's other weeks where you're flying by the seat of your pants. You're opening up the fridge, you're pulling out whatever you can find to try to make a meal, and by 9 o'clock, you probably find you're more cranky. This goes the same with stress. We don't think about stopping for 10 minutes on a Saturday or Sunday and thinking, how do I want this coming week to look? And if I write it down, it's more likely to happen. If I write down what days I want to work out, or what days I'm going to schedule a phone call, or what days me and the kids are going to have this activity, it's more likely to happen. I also reference work. When bosses give us tasks and tell us what to do, we feel less interested. But when they give an idea and then let us supplement the idea and kind of decide how we want to build that, we're much more motivated to work on it. So get the whole family involved. Ask your partner, ask your children what they want to accomplish that week, and give everybody a role so that they're more motivated to do it, and all the burden isn't on you. Dinner can be a great time to center things around if we prepare enough. I've seen some families do 15-minute really quick workouts all before dinner, and then they sit down and they either everyone shares one story, or bring something to the table, or they prepare a question box to go through things, or little games that they can do while talking. I'm going to show in the next slide a competition that some colleagues put together that really saved me back in March. We would take turns writing out different things to do each day, and they would send it out to the group. So you can see here, that was where I got the retro workout example, that was the Wednesday task. And on Thursday, nobody used social media during work. And on Friday, we all did yoga. And on Saturday, we all did this very intense workout. We all did it separately, socially distantly, fitting it into our own lives. But I would find I was more likely to text other people about it, or go on the spreadsheet to check and see who did it. And it was a way, again, to be physically active, feel like I got something done, and still feel connected to my friends. So that's a lot of ways to think ahead and try to build in a couple of these things as we go forward. But I also want to talk about, what do we do when the stress is here and it's happening? And I wrote out an example to just illustrate going through a couple of steps. So let's take the thought that maybe is getting stuck in your head. I'll never be prepared for the next school year. I'm just not going to be prepared for it. It's too much. And the question starts to go over and over in your mind. Am I making the right choice? How will the IEP be enforced? Do I have enough resources at home? Did he forget everything he learned last year? How do I get it all done? What if I fail? So this big thought has turned into all of these different questions that are doubting myself. What do I do then? To make it feel simpler than it is, I have think, do, redirect. And I'm going to go through those steps. The first thing I want you to do is take this thought, so we'll never be prepared for the next school year, and think, is that fair? Is that a true statement that I'll never be prepared for the school year? Possibly, but also possibly not. Is it helpful? No, it actually makes me feel pretty terrible. And would I say it to a friend? Well, no, I think if my friend called me and said, I'm never going to be prepared for next school year, it's way too much, I wouldn't say, yeah, that's too much. You're going to do a terrible job. And you can laugh at that for a second and say, that sounds really silly. But if you really reflect in your own life, you've probably had this thought go over and over in your head sometimes. Again, things you'd never say to anyone. So the first thing I want you to do is when the stressful thought comes up is ask yourself these questions. Is it true? Is it helpful? And would I say it to a friend? And if not, I want you to rephrase the thought to fit it. That doesn't mean we have to be hunky-dory Pollyanna and say, this school year is going to be great, because I also can't promise that. But what is true is I'm worried about how next year will go. It is not the most helpful statement, but it also isn't hurtful. And I would say that to a friend. Yes, I hear that you're worried about how next year will go. That is a true, accurate feeling statement and takes down some of the intensity. So the next thing we want to really break down is like, well, what can I do about it? I have this upcoming school year. I know it's going to be hard. And if I just sit there in that thought and repeat it and repeat it and repeat it, I feel pretty bad. But the days I sit down and make a list of all the things I need to do to get ready for the school year, and I pick one thing to do, maybe it's make a phone call or pack for an appointment or print off the materials the school sent me, then I've done something in the right direction to manage that stress. And then after I've thought about it fairly and I've done something proactive about it, I need to take myself out of the situation and give myself a break. And what I think people sometimes get wrong about worry is they say, just don't worry about it right now. Just don't worry about it. Don't be stressed. But that just leaves the stressor in there and you're doing something else, but it's still running through the back of your mind. But if you've been honest with yourself about how you feel, and you've done something in the right direction, then you can practice this point of doing something else. And then regroup the next day. Okay, what's one more thing I can do? Then take a break. I also wanted to talk about other parenting influences that influence our stress. I do believe all of you know this. I think it's still worth reiterating because we all fall into the traps. And I start with social media. As we see here, there's a young girl on the beach who's really just enjoying herself. She's probably feeling very zen and listening to the waves and having this really great moment. Why don't I do that more? I should do that more. This is why I'm always probably so stressed, because I don't go sit on the beach and really connect with myself. But then we forget that this is an inappropriate shot of their life, that this is lighting and probably some things cut out. And really, it's a hectic day on the beach, and they've caught a really great snapshot, and they've intensed the lighting, and they've added a filter, and they've posted this, and this is what people want to see. I'm going to share an example of the presenter coming up, who's a dear colleague of mine. She had just moved into a new house, and she posted this wonderful picture of her kid's birthday, and it was a beautiful background and a beautiful outfit, and I thought, man, she's amazing. She always has it so together. And so I texted her, how do you always have it so together? I don't. And she said, oh, Nicole, that's not what my house looks like. And as she sent the rest of her house, there were boxes and things on the floor because they had just moved in literally the day before, and it was chaos. But we send the right message out to people because we're looking forward to sharing our best parts of ourselves. And I think that's okay to do. We just have to make sure we're not comparing ourselves to the best parts of people that they are showing. When it comes to social media, I think it's actually done tremendous wonders for parents. It's given us a lot of social support. It's given us new ideas to parent or to keep kids engaged or involved. And we've also gotten a lot of information out about the things that you're probably seeking in terms of medical appointments. That being said, it can also have a negative impact. And that would be if you're spending a lot of time looking on the internet and comparing yourselves to things that are unrealistic. And if you're spending an hour scrolling on your phone, looking at all these things, and it ends, you find you have nothing to show for that hour. So where I told you being physically active and getting something done makes you feel good, scrolling rarely makes us feel like we got something done. And so it leaves us feeling a little bit more empty. Studies have shown that there's great ways to use the social media on there and who are liking different things and commenting and having conversations. Well, they tend to find a lot more benefit from social media. But it's the people who are scrolling and wondering why they're not doing the things that have more negative impact. People who use time-limited social media, so they give themselves 15 minutes to really go through the things that they like and then turn it off to do other things, report more positive affect. And the other thing is content. So people who are getting stuck maybe in comment sections of things that are stressful or comparing themselves to things that don't make them feel good versus looking at the pictures of their cousin's new house and their friend's new kid who turned 3. Those are the people who find more happiness because they're surrounding themselves with more positivity. The other thing I want to talk about is information seeking, because we have all read the internet. And if it's on the internet, it must be true, said Kermit. But we've all done this and we can laugh at ourselves a little bit. But asking yourself, where am I getting the information from? Is this person's story similar to mine? How long have I been reading these things and what are the other possibilities? Because sometimes I will have a parenting concern and my husband will come home and I'll say, I've read the internet and this is what we need to do. And I can feel him sigh and say, okay, because it didn't work. Because that story was nothing like what I needed. And so the next I read the rest of the internet that I found and have a new thing. But if I think I really consulted with a professional and looked at really good resources, I would feel better and I wouldn't give so much of my energy to searching and searching and searching. And I'd have more time to maybe go for a 10-minute walk or to add a little bit to my picture. And then I want to land on the whole purpose of this talk was to really cover parenting and stress. Again, parenting stress is distress experience related to parenting. And we've asked these questions of ourselves. Am I good enough? Did they eat enough? Do they know that they are loved? What if they don't sleep? What if friends are mean? What if he is scared? What if she needs me? Did I play enough? I probably worked too much. I wasn't patient enough. I should have bought more educational toys. I wish I had known better. We see these and we know that we should reassure ourselves, but in the depths of the night, these questions pop up in our head. And so all those normal stressors are still happening and they're couched in these other parenting stressors. So I'd like to introduce the concept of being a good enough parent. And it can be a difficult thing to think about. I'm going to quote this book, and sorry, I didn't realize that was in separate slides, but in order to raise a child well, one ought not to try to be a perfect parent as much as one should not expect one's child to be or become a perfect individual, because perfection is not within a grasp of ordinary human beings. We know this in theory. We wouldn't tell our friend to be a perfect parent, but we sometimes have this irrational thought that stays with us that we should be doing more, we should be doing more, we should be doing more. And that thought that we should be doing more is increasing our stress and again, adding to us snapping at our kids or not being there. Versus taking a moment to celebrate, what have I done well today? How did I help my kid well? Because the more I think about that, the more I'm enjoying the next book the kid pulls up, or the next activity, or the next conversation in the car. I wanted to give another quote that stuck with me from the book. That good enough parenting is not about being lazy or less interested or less loving parents, but about being more forgiving. It acknowledges that parents like children have needs. And while I think you are all amazing, we are not superhuman, and cheering ourselves on is just as important as we would cheer our kids on. Because our kids are learning from the way we cheer them on, but they notice we don't cheer ourselves on in the same way. And as they get older, they're going to model their coping from us. So being a good enough parent really targets taking a second back and thinking of the values you want for your kids. I want them to be flexible and compassionate, and I want them to have faith that things can be good and just and that we can share. But what we accidentally do when we strive to be perfect parents is we accidentally teach a little bit more perfectionistic tendencies, or being competitive, or being selfish, or to be demanding, because this push to be great gets really confusing and kids have a hard time filtering that through. And then we've missed those other things. So it's again stepping back and thinking about, am I being a good enough parent? Am I instilling the things that are important to me, like taking turns and setting a goal and working towards it, whatever that goal might be, of earning things, of helping each other, of apologizing, or learning how to express what they need and complimenting other people. Because I don't care if my kid walked before the other child. What I care about is, did they want to work at it, and can I teach them how to work at it? And it's not about the goal, but how can I set the goal and break it down and learn to get there? Some things when I'm thinking about parenting in this good enough way that can give us a bolster is setting routines. If I have some things that seem predictable in my life, I feel more calm and my kid learns a lot. So setting some daily routines, it doesn't have to be the morning night ritual, but I thought this was a helpful thing to look at, of having a couple things that happen in order every day. This can be annoying to kids at first, but it actually starts to help them know their parameters and what to expect from the day. It also helps them feel really good and accomplished that they are getting it done. They start to notice that you feel proud of them. I think a lot of our children struggle with executive functioning deficits, and that's a fancy way of saying the front of our brain that manages the planning of things, the organizing, the deciding what's most important, and the paying attention. By practicing repetitively these routines over and over and over and over and over and over again for some kids, they start to get it and they start to develop those skills faster. The other thing we can do is life can get kind of dull, especially if we've been home so much lately. So finding different ways to make a weekly routine. Maybe on Mondays, we try a new recipe night, and on Wednesdays, we all read a book together in our bedroom. And on Fridays, we have movie night. That helps set the stage of some fun activities and maybe lifts the other days where you get through the hard things because you know something fun is coming up and I'm staying oriented to what day it is because it's hard to keep track lately. Another thing I want to help when we're thinking about managing parenting stress is asking yourself if we're setting realistic expectations on kids. We all, again, get this in theory. We know that our kid struggles to remember 3 things to do. And so if I say, go upstairs and brush your teeth and bring down your light load of laundry and change into your pajamas, my kid doesn't do that. But if I'm in a rush and I can't help it, I shout those 3 things at it, and then my kid comes down with only one of the things done, I feel frustrated and I yell more. But maybe that was on me because I didn't set them up for a realistic expectation. And so checking in with yourself that you're making sure that what you're asking is achievable. And if not, set the goal on how to work there. But a way I can manage my stress is not setting myself up for failure. Similarly, are you getting realistic expectations for yourself as we say yes to things, or we decide all the things we want to work on with our kids or for school or for work or our house projects? Do I really have enough time for this? Do I have the ability? And is it really that important to me? Or do I feel like I should do it for whatever reason? And you have to be able to answer all of these questions before we set forth. Because if we're taking on too much, again, we're setting ourselves up for failure. It is hard to do 5 things well at once. But if I can focus more of my time on 1 or 2, I'm going to do it better. And then I can move on to the next things. The other thing is, while we are all great parents, we need a lot more people. And building your warrior team helps you have less stress. If you involve your family and your friends and you actually give them something that they can do if they're offering, that helps them feel like they can be part of your life and help you. And it also takes one thing off your plate. We're not raised in society to ask for that, but you can think of when a close friend has been through something really hard, maybe a hard medical diagnosis, or they've lost a parent. All you want to do is take their hurt away, and you can't. So that's why we bring over a lasagna, because it's something I can do. Giving your family and friends things they can do also helps you. But reaching out, having all these people in your corner, involving your kids' friends and their parents and a teacher, getting an intervention specialist at your school, getting a case manager through your insurance company or other abilities, reaching out to physicians and genetics counselors and psychologists, occupational therapists, speech therapists, physical therapists, having this whole team that can divide and conquer as you need them really can help take away some of it if we let them. And we realize our kids' lives are more enriched by learning other people and learning their styles too. Another caveat, I think, for talking about reducing stress is we are inundated with hard things lately. I think hard things that our kids are going through, hard things that we are going through, hard things the world is going through, and we might be missing some good stuff. These are some websites that really focus on positive news sources. I've personally used Optimist Daily and Upworthy.com, but I found Good News Network recently. I'm also a big fan of just going on YouTube and watching corgi videos. That is my rest and relaxation sometimes, to watch a cute little corgi jog along and shake their little tails. Or Googling and Pinterest looking for inspiration, but finding some time set aside to have good inputs into your brain. That brings me to a gratitude journal, finding deliberate ways to pay attention to what is going well. So someone recently asked me if I would know that 2021 was going to be better if I would take a pill and go to sleep and wake up in 2021. And my first answer was, sure, this has not been going great. But as I thought back to the past few months, how hard they were, there's also been a lot of good. Maybe I've worked on communication with my husband. Maybe my kid hit that point where they learned to tie their shoes and that felt so good. Or they tried a new food, or we've all worked on talking about our feelings. I also don't want to miss those moments. So while you're not paying attention to all the stressors, but if you've allowed yourself to think and do and move forward, we also want to make sure we're filling some of that space with what is going well, because it's balanced. And if you go back to that cup with water, we don't have to be all positive that the cup is so full of water, things are great. Maybe it's not empty, but maybe it has water and there's some good things happening and some hard things happening, and I want to pay attention to that balance. A note just says, I think we all need to keep hearing this as many times as possible, is you're human first and you matter. You are the world to your children, even when they're screaming at you, even when they're saying that you're doing it wrong, even when they're not talking to you. You know that in the end that you're who matters to them, and the way you can be the best for them is doing some things for yourself. And so reflecting on what is one thing I could do differently in the next week to feel a little bit more like me, a little more connected to me, a little more to help me. And forgiving yourself, because I recognize that some people, when I give these talks, start to think little checklists of the things they're not doing. Why wasn't I doing that before? Why didn't I think of that? And that's not the purpose of this talk. This purpose of this talk is to just sit with where we're at and to expand ourselves a little bit, to be kind to other people. We go back to that phrase, but I say it to a friend, you most likely wouldn't. All the things you judge about your own parenting, you would never call up your neighbor and say. And if you wouldn't say it to them, you probably shouldn't be saying it to yourself. It's a valid concern, but it's not a fair way to say it. When to talk to a professional. Oops. Let me see if I can get this all to show up on one slide. So I want you to know that mental health professionals are available now, some in person, some via telehealth. And when should I reach out to them? When should I get extra help? If you're parenting infants at this time and you're noticing that you're having both mothers or fathers some postpartum depression or anxiety, that's similar to those symptoms of depression and anxiety, but it's usually more infused by feeling disconnected with your child or not feeling like yourself. That would be a time. Or if your child really is having a lot of sleep, feeding, or fussing issues that feel more than usual, reach out to your primary care, talk that through and see what else they think would be helpful. For toddlers or preschoolers, things like having a lot of trouble with tantrums, not able to talk to other people when they come over, so having this like very extreme stranger danger. If you see kids making gains and going backwards, or feeling a lot of frustration as you're trying to teach them new skills, reach out to a professional to get some tips and tricks of what to do. That might again be OT, PT, or speech. It might be a mental health licensed social worker or a psychologist. For school-age kids, noticing that they're having much more worry or being more fidgety or having some behavioral difficulties, I generally say looking to see if kids are different. If you have a really talkative kid who gets quiet, if you're a really quiet kid that gets tearful or clingy or starts yelling more, these changes usually mean something else is going on. In teens, their symptoms of anxiety and depression look similar to adults, but I would say irritability is one of the bigger things. And again, it goes back to those changes and things that you notice. And for parents, again, all of these things that we're talking about, the stress is normal, but if it's creeping up and it's impeding your way of being happy or enjoying some good moments, it might be time to reach out to someone to see what would be helpful. If you find yourself choosing unhelpful coping styles like substance abuse more often, or you find yourself not parenting in the way that feels good, it might help to talk to someone. Sometimes just unloading all the stress can be enough to feel heard and validated. Sometimes we need a couple more sessions to learn different strategies or to practice and come back and say what worked and what didn't. All of these things are normal and they're okay. If you need help looking for a for a professional, reaching out to your primary care is a great way to start. Your child's school might have counseling, employers also have EAPs, but I really advocate for people to call their health insurance companies, because sometimes when I give referrals, they're not even covered by your health insurance. So finding that list. I also wanted to put on the National Suicide Prevention Lifeline. That's a phone call service that's available 24/7. There's also a text crisis line. So if you don't feel comfortable picking up the phone, there's a text line where you text the word home to 741-741. These numbers, you don't have to be suicidal to call, but if you were having a moment and you were all by yourself and you're just feeling very, very intense and it's just hard to kick the feeling, feel free to call. That's what they're there for. A crisis doesn't have to be, I want to hurt myself, but it can be, I need help right now. I'm going to skip real quick and just show you some of these slide resources, but I will also send these to be distributed. These are a list of apps that cover all of those relaxation strategies that we talked about. All of them, I think, except for Headspace, should be free. Though if you look on right now during the pandemic, Headspace has had a lot of good deals to get it for discounted rates. I also wanted to include a book resources for kids. The Dawn Huebner series are a series of workbooks developed for school-age children that go through all the things: anxiety, behavioral difficulties, a hard time sleeping, managing anger. And so it's a good workbook that you can actually work on with your kids to make sure you're on the same page and addressing some of these challenges, because the more you address their challenges, the more you're going to feel a little bit less stressed. And the last one I put on is some resources for adults that have found helpful. These are books that are, again, more practically based on evidence-based research from psychology. So the Acceptance Commitment Therapy, Mindful Change book, the Cognitive Behavioral Therapy Made Simple book, or Positive Psychology in a nutshell. And so I wanted to make sure these resources are had. I also have my contact information at the end. I have more book ideas if you have specific questions, or I'm happy to talk through different scenarios if you're wanting to know what direction you should head in. I'm always available, and I appreciate everyone's time so much.